Welcome back to the Now Morning Show. Our next conversation focuses on the Caribbean Association of Oncology and Hematology. They'll be hosting a conference in Grenada in July. And the theme is a holistic approach to cancer care. Joining us in studio is Dr. Marisa Nimrod, CEO of the Caribbean Association for Oncology and Hematology. Good morning, Dr. Nimrod, and welcome.
Pleasure. Good morning. Thank you.
It's a pleasure to have you with us on the show. How are you?
I'm great. Thank you for having me here today.
I'm really looking forward to this conversation, aside from the fact that, this conference is taking place at one of the most fabulous campuses in the Caribbean. This is such a critical conversation that we need to have, because when it comes to cancer and the holistic approach, many times it tends to take a backseat to that which we all automatically go into, which is treatment and so much more. But before we get into that, let's get a bit of background into the Caribbean Association for Oncology and Hematology. Can you share a bit with us?
Okay, sure. So CAHO, which is the simple form of it, is actually a non-profit NGO. Was started since probably 2008 by Dr. Peter Bovell. Since then, we've had some transformation. So it's actually broadened its scope from oncology and hematology as specialists to making it more inclusive with respect to all other specialties, allied health professionals, nurses, even cancer patients and cancer advocates. So we're taking very much a public health perspective in terms of making everyone important in this cancer journey.
Definitely, it really is a journey. Now, can we elaborate on the holistic approach to cancer care? And in fact, no, before we get into that, why do you think now it was important for the group to come together and focus on the holistic approach to cancer care?
Right. So with respect to my perspective, my interactions with my patients, they are normally the ones who give you the information that you're looking for. So we normally take cancer as a diagnosis in terms of the physical perspective, but you hear even from a cultural perspective, persons discussing things like bush remedies, for example. So you would hear the moringa, you would hear everything, soursop going, and they would want to know, how does that affect their treatment? How does that prevent cancer, for example? Persons lack counseling at times, the psychosocial support and therapy. So again, listening to the conversations of the persons who are actually recently diagnosed, been diagnosed, we thought it would be important to actually have these other facilities factored in. And this is actually in keeping even with first world international standards. So for example, American Cancer Society has a very strong patient navigator program that looks, focuses on things as simple as just transportation in terms of access for persons to get to and from their treatments. So when you actually look at the entire spectrum with respect to the disease, we thought it would be crucial to actually start addressing this within the Caribbean culture as well.
Definitely. Culture is one thing that does affect such a wide breadth of things, and many times we don't think about it in the medical sphere particularly, and treatment sphere as well. How would you say traditional cancer treatment methods differ from the holistic approach, which is going to be focused on at this conference?
Okay, so we actually would approach the disease in terms of a biopsy or intervention. So we look at the physical component, surgery, chemotherapy, radiation therapy, depending on the disease we're looking at, and obviously what would be standard of care in terms of our treatment. This time we intend to integrate and focus on things like the mental health. We're looking at precision medicine. We're looking at psychosocial therapy, counseling. So some of the topics will include, how to navigate intimacy with a cancer diagnosis. Because at the end of the day, persons are persons, and these things are important in terms of relationships, even physical relationships. We're looking at nutrition, which is a key part of it. Most persons don't know what to eat when they're actually, having treatments. Do I eat meat? Do I not eat meat? So again, we're trying to also address those other topics. So we're looking from both physical, mental, spiritual, so we're just taking that full approach from a public health view.
It's wonderful to see from a public health view the integration of the emotional, mental and spiritual aspects as well, because many times, again, it gets a bit swept under the carpet or put to the wayside because you're focusing on those physical aspects that you say need to be healed right away. Do we have any success stories in the Caribbean of implementing this sort of, non-traditional method, for want of a better expression?
So one of our countries, or member countries, be like Jamaica. Jamaica has a pretty strong program where they actually look at integrating both that counseling support. They do music therapy, and I dare say people look in terms of palliative care. We're hoping to have that topic again with respect to things like cannabinoids, you know. So it's noted to actually help persons with respect to their overall perspective, reducing pain. Music therapy in the US has been shown with respect to pain management to improve and even reduce the threshold or the intensity of pain, and even reducing things like fatigue, which is sometimes a hallmark feature of persons who are actually having some types of treatment, including chemotherapy.
Definitely things we've also seen making, you know, waves across the world when it comes to developments in medicine, and especially going to herbal treatments, for example, as you would have mentioned earlier, from, as we would know, traditional bush remedies to now seeing cannabinoids being included. There's a lot that needs to be focused on. Now, you mentioned the cultural context and how it can affect treatment. Would you say there are any unique challenges that the Caribbean faces when it comes to implementing these?
Right. So, so again, we would have, and this would be across, you know, different countries, different levels in terms of financial resources. So we know we have limited resources. It's probably at different hospitals, countries. We're looking at even a paucity of specialists. So we may not have that many oncologists or hematologists in the Caribbean. And then we're lacking some of the other resources that may be necessary, not just the treatment options available, but even just medical social worker and navigating some of the other support systems going forward. So I think it's important to see how best we can build capacity for the other countries. I know, for example, the OECS, the Organization for Eastern Caribbean States, they work as a team and they're actually building out a pathway in terms of allowing access to a particular country. In this case, it'll be Antigua. So again, and Trinidad has always been the hub for persons coming in terms of their cancer treatments. So looking along those lines to fill in those gaps would be something that's important. And the cultural barriers that we spoke about, persons don't like bad news, especially men, for example. And then there may be religious factors in terms of persons, you know, wanting to have a pap smear done, having a female physician. So we want to have those conversations in the room and see how best we can develop solutions towards those.
It sounds like this conference is going to touch on some obviously very critical issues, some things that, again, we don't necessarily focus on, but also a bit of the future as well. Where do you see the future of this holistic approach within the grand scheme of the Caribbean region?
So I think it's going to be good, honestly speaking. There's more conversations happening, you know, so we speak about health literacy, taking that information and knowing what to do with it is really important. We're looking at advocacy. We find a lot more persons lending their voices towards supporting a cause. And in particular, the stakeholders who are going to be at this meeting, in particular at Grenada, are going to be discussing and having meetings with the policyholders. So we're looking at things in terms of like guidelines, looking in terms of resources to do research, because research is being done, but a lot of times, I mean, it's siloed, so we may not know what someone else is doing, and then hopefully translating that in terms of translational medicine into some sort of policy or some sort of guidelines that can actually help persons to appreciate and to uptake what is being done, because everybody's interested in cancer research, breast cancer research. How do we make that gap or connection from the research into best practice? So again, hoping to have some of those discussions with respect to translational medicine. And we hope it's going to take off, because I think, you know, there's an interest going forward. So yeah.
There definitely is an interest going forward. I think many times you would have mentioned, particularly with that interest, for some it's even those outside of the medical field. They want to know what the latest advancements are. They want to know, be in the know essentially, because you never know what can happen. Now let's go to the actual conference itself. July the 11th to the 13th.
Yes, it is.
It's going to be taking place, but it's taking place in Grenada. What about those who may be interested in attending but can't make their way?
Okay, so we're quite happy to have persons join us via hybrid medium. So it's going to be online. Our keynote speaker is actually Dr. Didicus Jules. He's not a physician, and we did that on purpose this time for people to appreciate it doesn't have to be a doctor at the helm, but someone who obviously supports the whole vision in terms of cancer prevention and control. So he's very experienced, very knowledgeable person, and he's going to be highlighting the Caribbean perspective, especially from the OECS representatives, and hopefully persons can log on and see what's being done across the Caribbean.
Excellent. Now, you mentioned your feature speaker not being a doctor, which agreed. something phenomenal to be done, hopefully setting a trend for some other conferences. Who else is going to be speaking at the conference?
So we have a featured speaker. So it's Dr. Julie Graylow. She's the Vice President and Chief Medical Officer of ASCO, the American Society of Clinical Oncology. That's kind of like, the Mecca or gold standard in terms of cancer care and clinical trials and information coming out. We have quite a slate as well. We have Dr. Bodkin from Six Kids Caribbean, Professor Marvin Reed, highlighting the importance of general practitioners or GP, because if you can't diagnose it, especially on time, then you can't get the treatment that you need in terms of an intervention. So the GPs are actually the primary care or the gatekeepers. So again, trying to make sure that everyone has a rule with respect to that cancer prevention and control model.
Excellent. The fact that you mentioned GPs definitely has stood out to me, and mentioning that they are gatekeepers as well, because we always know from growing up and then to having our own children, you need to go and have these checkups, and this is where we can set that foundation. Where can we get more information about the conference?
Oh, so you can log on to our website. So it's CAOH Caribbean, CAOH Caribbean .org, and you should be able to access everything from the agenda going forward, the cost, everything's online. And for those in Trinidad and Tobago who'd like to just pop across to Grenada, I mean, it's just right there. The accommodation is actually online at the Radisson, and we're trying to make it affordable for doctors interested, for example, in what we call CMEs or continuing medical education credits. We've gotten the maximum this year, so it's 25.5 for 2.5 days. So we're quite excited for persons who actually need to get those credits with respect to their renewals, that's available as well.
Excellent. And registration will be open till when?
Straight up until the conference.
Yeah, definitely something that I think that's, if we're going to speak about culture, that's uniquely Caribbean culture. We have those last minute registrations.
Listen, that's always been the name of the game. So I'm hoping people will come on board. I'm speaking on bush and cancer, complications or cure, because a lot of people, again, will subscribe to having, St. John's wort, which is a natural blood thinner,
Yes.
So again, how does this affect your conventional evidence-based treatment? Is it really a cure? Is it a complication? So I'm excited to present on that topic as well.
I'm excited to hear you present as well. This seems quite interesting. Dr. Nimrod, thank you for joining us.
Thank you.
All the best to you and your team for this conference. I'm looking forward to many more.
Thank you very much.
Dr. Marisa Nimrod, CEO of the Caribbean Association for Oncology and Hematology, joining us this morning to speak about a conference, a holistic approach to cancer care, taking place in July in Grenada. Stay tuned. We'll be back in a few moments on the Now Morning Show.